You go in for a routine checkup. Everything feels fine, and then your dentist says, you need a deep cleaning. Your first thought is probably, what does that even mean, and why does it cost so much more? A regular cleaning runs you maybe $100 to $200. A deep cleaning? Often $800 to $1,500. Sometimes more. So is this legit? Or is your dentist upselling you? I'm going to explain exactly what a deep cleaning is, why you might actually need one, and how to know if you're being told the truth. A regular cleaning, what we call a prophylaxis, is designed for healthy mouths. It cleans the part of your tooth you can see and just slightly below the gum line, maybe a millimeter or two down. Your dental hygienist removes plaque and tartar that your toothbrush can't get to. They polish the surface. Done. This works great if your gums are healthy. The key measurement here is called a pocket depth. When your dentist or hygienist pokes around your gums with that little metal probe and calls out numbers like 3, 3, 4, those are millimeter measurements of the space between your tooth and your gum. Healthy pockets are 1 to 3 millimeters. At that depth, a regular cleaning reaches everything it needs to. When those pocket numbers start hitting 4, 5, 6 millimeters or more, that's where the problem starts. At that depth, bacteria aren't just sitting on the surface of your tooth. They've moved down below the gum line, onto the root of the tooth itself. That area is called the root surface, and a regular cleaning can't reach it. Left alone, that bacteria causes something called periodontal disease, or gum disease. It doesn't just affect your gums, it starts destroying the bone that holds your teeth in place. This is why it matters. This isn't cosmetic. Bone doesn't grow back. A deep cleaning, clinically called scaling and root planing, goes all the way down to the root. The hygienist removes that bacterial buildup from the root surface and smooths it out so bacteria has a harder time reattaching. It's usually done in 2 appointments, one side of the mouth per visit, and your gums are numbed first. It's not pleasant, but it's not as bad as people expect. This is the part people always want to know. Can I trust this recommendation? Here's what I'd tell you. Ask your hygienist to walk you through your pocket depth readings out loud. A healthy mouth should have mostly 1s, 2s, and 3s. If you're seeing consistent 4s, 5s, or higher, especially with bleeding, a deep cleaning is legitimate. You should also be able to ask for your full periodontal chart. Any reputable office will show it to you. Now, can someone oversell a deep cleaning? It happens. If your pockets are mostly 3s with 1 or 2 borderline 4s, and no bone loss on your x-rays, a good dentist might monitor you rather than jump straight to treatment. That's called watch and wait, and it's appropriate in mild cases. But if bone loss is visible on your x-rays and your pockets are 5 millimeters or deeper, do the deep cleaning. Skipping it doesn't save money, it costs you teeth later. After a deep cleaning, most patients come back in 4 to 6 weeks for a re-evaluation. We remeasure those pocket depths and see if the tissue responded. A lot of people are surprised. Gums that were inflamed and swollen often tighten back up, and those 5 millimeter pockets shrink to 3s or 4s, just from the cleaning and better home care. After that, you'll likely be put on what's called a periodontal maintenance schedule, usually every 3 to 4 months instead of every 6. That's not forever necessarily, but until your mouth is stable. The biggest thing you can do at home? An electric toothbrush and daily flossing make a measurable difference. Not a small difference, a real one. Studies consistently show electric toothbrushes reduce gingivitis better than manual brushing. I'll link a couple of the options I recommend in the description. So here's the bottom line. A deep cleaning isn't a scam. It's a legitimate treatment for a real condition. The key is making sure the diagnosis is backed by actual measurements and x-rays, not just a gut feeling. Ask questions. Ask to see your chart. A good dentist will welcome it. If you found this helpful, subscribe. Every week I break down exactly what's happening in your mouth. In plain English, no dental jargon. I'm Ask a Dentist. See you next week.